just spread out a little bit here. First of all, when you look at the heart, remember that these are coronal cuts, and because there's a coronal cut, there's going to be a ventral side and a dorsal side, okay? And you can always tell the ventral side by two features. That's what I use anyway. You see this interventricular sulcus? It's oblique, right? You see this big opening up here? What is this vessel? Pulmonary trunk. That's always on the ventral side. This is always oblique, okay? And you can tell this is an artery and not a vein because thick walls, right? Okay. So this is, over here is the left ventricle, and this is the right ventricle, and this is the left atrium, and this is the right atrium. And then right here is calamari, right? So what is that? Aorta, right? And then if we roll the heart over, we got this thing that looks like a skirt. Yeah, what's that? Pericardium. Okay. Now, so right here, there's some stuff, and you see these dark things right here? Anybody know what that is?
Bronchus.
This is cartilage, right? That's how you tell the bronchi, right? Because the bronchi will have cartilage in, the arteries and veins will not. Okay? All right. Now, there is a really thin tube right here. See the walls are all like paper thin? Mm-hmm. This is the caudal vena cava. And then if you look up here, oh, see this is the aorta? See there's this hole right here? Everybody know what it is? Third branch off the aorta. Brachiocephalic. Left or right? There's only one. Okay. Now right up in here, there's going to be a hole that goes down into the right atrium. It's right here. See this right here? Thin walls. And if I put the blunt end of the probe and go really gently, you see it comes out into the right atrium? Mm-hmm. So that is the cranial vena cava. Okay. Coronary sinus. So I'll show you the coronary sinus. This is kind of a neat trick. So in here, there's an opening. Now, if you do this, I need you to be really gentle. The walls of the coronary sinus are very thin. And if you are at all, kind of violent with it, it will rip. But watch right where my thumb is. See where my thumb is? Mm-hmm. Watch. Can you see that thing move? Yeah. Mm-hmm. That's the coronary, that's the roof of the coronary sinus. So remember, the coronary sinus looks like a Quonset hut, and we're just touching the roof of it. And the floor would be the wall of the heart, because it doesn't make a complete circle. It only makes a partial circle. Okay, then if we look into the right atrium, we see these things that look like tree roots. They would be pectinate muscles. And then we have a trampoline down here, right here, and that would be tricuspid valve. And we have these things going from it down to the wall. Chordae, tendonae. And we pull that valve back, right back in here, you can see some things that look kind of like tree roots. Trabeculi carni. Over here on this wall, we may get lucky, yeah, right here, there's this nasty looking pimple thing. This is a papillary muscle, okay? On the ventral wall, oh, this is a great one. Well, we need Leah again, but she's not here. Oh, she's over there. Right over here, we see a piece of pasta going between the interventricular septum and the wall. That's the moderator band. And then this is the interventricular septum, yes? Yes. One of the hearts has been cut through the wall of the right atrium, and you can actually see the fossa ovalis. But in a heart like this, you can't. So what you do is you put your two fingers into the dorsal half, into the two atria, and where I'm bringing them together right now, it feels like all I have is a glove between my fingers. That's the fossa ovalis. Before I leave here, we got something exposed real nice. So see there's something that looks like a shirt pocket right here? Mm-hmm. What would that be? Semilunar valve. And this is the aorta, so this is the aortic semilunar valve. Everybody with me?
Yes.
Okay. Now, in terms of the pulmonary semilunar valve, to see that, you'd have to cut right down through here into the wall of the right atrium, right ventricle rather. I've done that on one of the hearts, so you could see it. And then if you take your fingers right where my thumb and finger are right here, this is the aorta here, this is the pulmonary trunk here. Right in between them, there's a ligament, right where I'm pinching. And it's about the size of a probe. It's about that big in thickness, okay? That's the ligamentum arteriosum. Now, if you put your probe gently into the left ventricle, left atrium, and you go toward the dorsal side of the heart, you'll come out through a hole. See it right there? Mm-hmm. So that is a pulmonary vein because it connects to the left atrium, right? Did we miss anything? I don't think I missed anything, did I? Can anybody think of something I missed? This is the bicuspid valve over here?
Yeah.
Okay, and these are chordae tendineae, and these are papillary muscles here. I think that's pretty much it. That's the apex down here.
Pulmonary artery.
Pulmonary arteries come off the pulmonary trunk. So if you push through here gently, it comes out over here someplace, like right there. That's the left pulmonary artery, and the right one is right there. Okay. That's the right pulmonary artery. The right pulmonary artery initially kind of goes dorsally, but then it makes a U-turn and it goes to the right. Okay, we got everything pretty good. That's the sulcus, I already showed you. The coronary sulcus is between the atria and the ventricles right here, this depression. All right. So,